new St. Paul's Cerner build path to date. Some time ago now, we started to gather some preliminary requirements on what would be expected for the Cerner build for New St. Paul's Hospital. And we did some high-level engagement to identify areas with new and changing workflows. Those areas had a more in-depth pre-design sessions last year to really explore those new workflows, which was called phase 1. Or pre-design. And then currently we're now at phase 2. So we're now engaging with all areas to confirm if there's anything which has changed since those first discussions, and also to validate the essential build updates which are required due to the change in physical locations, such as printers and bed mapping. So phase 2 will run for 1 year with 4 cycles. They're about 12 weeks long. And the eating disorders is being covered within cycle 1, along with the other inpatient mental health units as well. So this 12-week period runs up until Christmas. And during this time, we'll validate the necessary changes, and the Cerner build for the eating disorders unit at New St. Paul's Hospital will be completed. And then at the end of this cycle, we'll send out a build summary as a confirmation of the build. Are there any questions about that process or the purpose of today's meeting?
Yeah, hi, it's Jan. I just wondered, the Cerner build, does that mean creating our templates that we'll be using in Cerner in our program? What does that mean, Cerner build?
Yeah, so that's you currently have Cerner build for your unit, and you have your rooms and you have your orders set up in specific ways for your unit. So it's just looking at that current build and what we need to change for the new site and what needs updating.
Okay, thank you.
Okay, so I thought we could start by just having a look at the floor plan of the new space. So this is the floor plan of the 8th floor, and the eating disorder unit, I've just put a red box around that so you can see it, and it's 8C North. So it's next to the eating disorders outpatient clinic. And then within this wing, we have a south side as well, which is going to be the medical and mental health unit. So the patient rooms are down the sides by the windows, and then in the middle we have some of the shared spaces such as the medication room and storage spaces, and then there's also the care team stations as well. So there's one here for the north side, which will be the eating disorders unit, and then one for the south side, which is the medical and mental health unit. So we will have a look at the care team stations in a bit more detail in a few slides, but is there any questions about this floor plan or anything new you'd like to discuss? So when we think about the eating disorders unit in Cerner, the Cerner build, we know that current state it's named NSPH 4 Northwest, or there's the shortened blue banner display NSPH 4 NW. But at the new site, as we saw on the floor plan, it will be on level 8, and the area is 8C North. So all of the inpatient units will follow a standard naming convention at the new site. The prefix will remain SPH, then we will have the unit name, and then it will end with JP for the Jim Patterson Medical Campus. So this is how the eating disorders unit will appear in the system for the new site. And also we're updating the facility name for all the units, again, to reflect that Jim Patterson Medical Campus. And then we could also see that you have a work QM. So do you know if this SPH4NW work QM gets used currently? Yes. And we are still working out the like the naming, the numbers, but would you have a preference to update the name of this in alignment with the new name for the new site? Yes, to update this. And what documents are you currently receiving to this? Sorry, Sharon, you're on mute.
Sorry. I'm wondering if Luz can, for some reason her audio. Oh, okay. Luz, you're welcome to come down the hall and join me. And can we just put a pause on that question for the work queue monitor? Because I think she'll have the most comprehensive knowledge around that.
Yeah, of course. But you do think that it should be updated to also have 8C North?
Yes.
Rather than keeping the old? Okay,
yeah.
Great. Okay, we'll come back to that one. Then this is just the bed mapping table with the current SPH unit room build and then the new hospital room build. So currently in system, we have 4 private rooms built and then a bay with 4 beds. Then at the new site, there will be 8 private rooms allocated for this unit. And then the 8033 to 8044 is, 40 is just the room numbers. Then we have the lounge beds, which will be built out standard for all inpatient units. And then it looks like there's also a group therapy room. Is this new? Is this not something you currently have?
We do have a group therapy room.
Okay. Do you schedule to this room currently? Do you need to be able to schedule the room?
Well, internally, I guess we have a schedule for the room, but do you
Out
mean
of system? That's something you just keep amongst yourselves in the department?
you're asking about scheduling the group room?
Right now, yes. So whoever wants to use the group room, we need to put it in the calendar.
Okay.
Yeah.
But you don't schedule it within Cerner?
No.
Okay. Jan, did you have anything?
Oh, I just was wondering if we're talking about the group room within the inpatient treatment program. That group room is used with the schedule that we have for the program, the groups, etc. It's already established when that group room is being used.
Okay.
Yeah, I'm just going to say, and then yeah, as Luz was saying,
I'm sorry, I'm doing dual function right now. I thought like the group room, like
DV,
outside
that-
is the DV.
Yeah.
Sorry about that. Okay, you're right, Chen. So basically the group room that we have right now is utilized for different activities during the day, and it's already set on the front of the schedule.
Okay, so no plans for that to change at the new site. We'll still. Okay. Perfect. And if it's okay with you, we'll just go back to the work QM. Sorry that you couldn't hear us. We were just talking about your work QM that you have called SPH4NW. So we were talking about the new site. The naming is likely going to be updated to 8C North JP. So it would be the same as your in-system naming, but we were just wondering what documents you're currently receiving to that work QM.
Honestly, not really a lot. So we use the work queue because when the patient gets discharged, they have the when I leave the hospital form so that the social worker can have access right away. But in the 4 Northwest unit, every time the patient gets discharged, I make a copy of that form and give it to the social worker right away for follow-up. So it's not really in our unit, it's not really like necessary for us to have that work queue for that reason. So basically, I don't receive anything so far in that work queue, unless of course I use it for scanning the form and send it to and then attach it to the chart. But the thing is, as soon as the patient is discharged, I put all the documentations right away and send it to health records, and they do everything.
Okay.
Yeah, including when I leave the hospital form.
Okay, but it is useful to have that functionality to be able to
Yes, but it's
something.
good in case because there's at times that other clinics will send something there by mistake. So what I do is I print it and I fax it to the right people or or give it to the right person.
Okay.
And Chris, oh, I don't know if that will be part of the new functionality of the e-fax or the right fax. Does that use?
Yeah, that will be similar where it's within your, you scan it into a system and then bring it into email to fax out that way. So it is very similar, but it's not attaching it to the patient chart like they can with WorkQM.
I see.
Yeah.
Jan?
I just wonder, this is a new term for me, but I just want this WQM. But what about Lou's, like cardiology requisitions, lab requisitions, things like that, where patients are those kinds of Cerner orders? Is that different?
That's different because
Okay.
WorkQ Monitor is a fax, basically, incoming faxes. So there are times that those faxes are not intended to us. So we send it back to where it should go. And in my case, basically, the only use of WorkQ for me is just when I leave the hospital form. That's basically it. Yeah, I've been checking the work queue for the past few days and it's been empty because I haven't been using it basically. And there's no, like, it's really odd times only that faxes come by mistake. Yeah.
Okay, want to make sure.
Okay, great. So I'm just going to talk about requisitions now, and so the printers and devices. So I have a floor plan here, which is a care team station, and this just has some of our devices labeled on here as well. It just looks a little bit busy, so I'll just talk through it. There's the lower care team station here, which is the one that's enclosed. There's the PCs on both sides with the dual monitors and space for the wows. And then there's also the laser printer here, which is that purple box, and that's been labeled in the red text at the bottom. So I've just put that in the laser printer, which will be for the unit. And then in the top care team station here, there are again 2 PCs with the dual monitors. And then if you just see this little orange box, this is the label printer. And again, we've just taken this red text and just put this in for the label printer. So we're expecting that this would be the registration area for patients with the label printer. Is that correct?
So you mean like when we register the patient, there are 2 printers basically in there. So one is used by the nurses, and one is when I registered, the label that goes into the chart and their wristband and all that. Yeah, patient label and the one with the QR code and and other stuff. But there's another printer that the nurses are using for urine and whatnot. Yeah.
So this is just the current setup for the new hospital. So there's just going to be the one printer here within the care team station, and then the label printer here.
But are you saying
we have two? We have 2 small printers for labels. One that is attached to, the lab, work, and then one is when I register patients, or if I just want labels for their charts.
Okay, and what was the first one? Sorry, the first labels?
The first label is basically for the one with the QR code for for the charts, their bands when they come in as I register
the one
for
that
new
you
patients.
use? And then Christy, I think the other one she's
for the
saying
lab.
is the nurses use for the lab.
Yeah, for the nurses.
Right. Okay.
So
this one is for the patient labels that would be going on like any forms or prints out or charts. Yeah.
And then do we have the printer for the lab?
I don't think they've been labeled yet, if I'm unless you know anything different about that, Mike. But I think at the minute we've just got the labels for the general label printers and the laser printers.
Okay.
So is it correct that this area up here is where the patient will be registered? There's 084820, where the 2 computers are here.
I think so. You'll be working up here.
Oh, so there's 2. Okay.
Yeah,
Yeah,
and they've both got the 2 monitors, and then the 2 pink boxes are the 2 PCs.
Okay.
I just want to confirm that, because I know,
Yep.
Jan, you had raised a question about where the clerk will sit due to just having confidential information around them and patients being able to see. So is that where you want the clerks to sit? Or the
You
unit
just
coordinator?
unmute.
Yeah.
Jan, you just unmute, sorry.
Sorry, I was just thinking we have our tour tomorrow, and that was one thing I really wanted to look at. Was that front part there. I wondered about the windows and how much patients could just look down and see other patients, because our patients are so ambulatory, right? And they're at the desk a lot, handing in pass requests, asking to see nurses. So I'm not sure. I think we need to see the physical space, and Luz and I have talked about this, to just look at it and see what makes the most sense for where her workstation will be. Yeah.
Okay.
So sorry, can't give you an answer to that yet.
Okay, that's not a problem. We can come back to that and follow up with that one. But the printer, happy with that being in this enclosed area and having this as our main printer for like our lab requisitions and bed reservation requisitions and any like SunQuest if that was downtime, then they would print out down here as well in the main printer. Sorry, Sharon, you're on mute again.
Yeah, I'm just kind of mumbling to myself. Jan, I think that the configuration looks okay. Hey, to have it against the back. This is a pony wall or something here. Is that right, Christy? Behind it? Or is it a full wall?
I'm not sure on that. It looks like the door's here. I'm not sure what this black.
Yeah, it's not.
That black box is a post.
Okay.
I will, in the background, pull up and see if that's a pony wall or a full wall. See if I can tell. Sorry, and I was just going to add one more consideration for Jan for you tomorrow. You see where the yellow PC label is? That's your downtime computer. So often that is where the clinical support clerks will sit at that downtime. It doesn't have to be that way, but just when you're looking tomorrow, keep that in mind as well.
And close to the printer.
To the printer. Yeah.
Yeah, that might be a good spot. We can look at that.
Yeah.
Okay, great. Okay, so we'll follow up with that after your visit tomorrow. And then we don't have any information on a narcotic printer. Is that correct? You're not expecting to have a narcotic printer?
We do have a narcotic printer now.
Okay.
It's not in the care team base, but if there's space, I think it's fine.
Sharon, where is it currently? Because I don't think Jason captured that in his walkthrough.
It's in the photocopy room, which is outside the hallway, outside for Northwest.
Is that used by inpatient and outpatients?
It's for outpatient office, next to the outpatient office.
Is it used
on
for
the
both?
hallway, outside the hallway?
Yeah, but is it used for both inpatients and outpatients?
I honestly don't think it's used by anyone.
No.
Yeah, we had this discussion when we got the printer that we would have quite low need for a narcotic printer. But I guess in the event that somebody did need a prescription as they were leaving, that would be where we would get it.
I think what's challenging with this, Sharon, is that with the way that the addictions team functions at our hospital, they're kind of the only ones that are allowed to write those prescriptions. So I actually don't think we will. Do
you want to take, maybe we could take that back to the psychiatry team. Like, I'm fine not to have, have no attachment to the narcotic printer, but I don't want to make, but I think we took it back to them to begin with, and they said they did want it. So I think
Okay.
if we were going to change that, we should consult with the whole group.
Okay. So this is just your registration default printing. Top one is the defaults that auto print at registration, and then this one is your defaults for the print label conversation. Do you expect you will need any changes to this for the new site?
That's normally what, I print, like when I register, it comes out. So not that I'm aware of so far. Yeah.
Okay.
And I
Perfect.
just add more labels as we need
If
it.
you need them.
Yeah.
Okay.
And that's the one that is, remember I mentioned to you about the nurses, another printer. This is a different size to what they have. Theirs is a different label. So that's why
Okay.
it's a different printer as well.
Okay, I see. Thank you. We'll take that one away and just check on that one. And then, so just thinking about document scanning, I know you said that you send a lot of your documents to health records for scanning. So at New St. Paul's Hospital, we're still expecting to be sending documents to HIM to upload to the chart. And there's not expected to be any changes with the unit uploading any documents. And then with your reports, are there any changes required to your current setup with who has access to the reports or how they're printing?
I'm not sure if this is the question that you're asking, but there are some challenges with people that we frequently send reports to not being in the Cerner distribution list.
Oh, so that's for your notes and documents?
Yeah.
Okay. Yeah, so this is more the reports that are printouts from Cerner. So like census reports or any reports that you might gather on your populations, things like that, that you would run a report and then print out. There's no expected changes for that for the new site. No. Okay. And then I'll just quickly run through orders as well, the current setup that you have for orders. So with labs, we expect that approximately 80% of the time collection for blood specimen is done via the VPP lab collection rounds. Is that still correct? The new site?
Yeah, so all blood work basically when the patient comes in, once the order gets through, they come right away.
Okay. And then for non-blood specimens, approximately 80% of the time, is this done on the unit by the unit staff?
Yes.
Yeah,
Sometimes
yeah.
like CNS, urine specimen, stuff like that. Yeah.
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 No expected changes for that. And then, so we've already established that we've got the main printer for any lab or transfusion printouts. And then we expect that there are no workflow requirement changes that would affect the current lab build. So we're expecting no changes for that and no net new order sets. Is that correct and in alignment with your expectations?
I haven't heard that there have been any proposed changes to our standard order set, our admission orders. I don't think there's been any proposed changes to that.
So that's the same information we have. If there are any changes expected, especially bone marrow procedures, venous blood gas collections, lab research orders, or lab specimen, then we just need to update that within the lab build. So we just need to involve the lab design team for that. And then lastly, on your current order build, within your unit, you currently have some special build around order tasking. So order tasking is where an order rule or power form generates a task to a task list. such as multi-patient task list. It's kind of like a reminder to complete the care activity. So there are specifics around whether tasks can be built, and they're only built for specific orders. However, some areas want to opt out of that. So they don't want that task being generated. And it's what we call order task suppression. And within your unit, you just have 4 suppressed tasks. So we just wanted to confirm that this was going to be the same moving forward at New St. Paul's Hospital, or if there were any reasons why this would need to change.
I wonder, so I see that emergency care ECG is listed as a suppression, but I think, do we want to switch that? Because hasn't that been a bit of an issue in this last little while, Luz, that they're ordered as urgent, but they often don't even come till the next day.
Yeah,
They're missed. And
that
we need
happens.
those done right away when people come in. So I'm thinking, should we actually make that change? What do you think, Julie?
Yeah, I mean, I don't know if I'm completely understanding the suppressed task, but we do certainly order urgent ECGs when patients come in that do need to be carried out on the day of admission. So I'm not sure if that's the change.
I don't know if it's the staffing issue or, yeah, because they've been really consistent. It's only lately that they have some issues. I don't know if it's staffing. I know that they're, like always, running around and short of staff, and sometimes their phone will come shortly, but they don't come. Yeah, because they're being called that they merged or something like that. So yeah.
So the suppressed task, it just stops that reminder that goes to like a multi-patient task list. So the order still goes through. It should still go to the ECG department. It just doesn't go to your multi-patient task list within the unit.
The task we're talking about here is what staff or clinicians on the unit will see. So when we suppress these tasks, we're not saying that the ECG department won't see that. It's just for our nurses.
Oh, I see. Okay. Thank you for clarifying that. Okay.
I think the secretary.
And yeah, in that case, I don't think the nurses need to be getting those notifications. I think those can all remain suppressed.
Okay.
Yeah.
Perfect. Thank you. Okay, I'm sorry, I do notice the time. So just finally, we've been told that there is likely going to be a new mental health worker role within the mental health areas. So we do have a mental health worker Cerner position, which is used at BGH, but we just want to make sure it's suitable to be used at Providence as well, and for the role that's expected within New St. Paul's Hospital. So if it's possible, would you be able to provide us with expected roles and responsibilities so we can just compare that with the Cerner access that we can give with the mental health worker position?
Christy, can I take that away? Because I think
Yeah.
there's been an update around that.
Okay. Yep, that would be great. And then
sorry, Sharon, remind me, I don't think there's any mental health workers that were submitted as part of the staffing plan for this area.
Not that I recall.
No.
And I think that it's not going to be part of our new model. Yeah. So I don't think it's relevant for Fort Northwest. Yeah.
And then finally, just confirmation that the binge eating program, we heard that it would be expanding, but there would be no requirements for Cerner. Is that correct?
Yeah, it's not a program. It's just an expansion of our mandate to include a new diagnostic.
Okay. Okay, perfect.
But just with that clarification, can anybody think of, with the expanded mandate, any changes that would be impacted or any changes that would be needed? nothing that comes to my mind specifically.
Oh, nothing's coming to mind.
I mean, I wonder about the like the order sets that we have, and whether that might need to be different for folks with binge eating disorder, but I don't think we have that information clearly yet. Yeah, it might need a new sort of power plan.
Yeah, that's a good point.
Or a modification to our current power plan, which could use some updates.
When do you think you'll be having further discussions about that, and what might be needed for it?
Well, I think we're just thinking about it for the very first time. Yeah. I guess if we were to review our existing power plan, Kelvin, you're usually the person I would reach out to if we needed a change to something. I think it would have to happen, or would most likely happen after we've had our staff training, so towards the end of November. And then how easy or not easy is it to revise an existing power plan?
So it is something that we can definitely do, especially if it's needed for New St. Paul's Hospital. Is it likely to be done before New St. Paul's, or is it something? Yes.
Yes.
Okay. Yeah, it would then go through the sort of sustainment process where we're raising a ticket and would be prioritized. So that would be the usual process through Calvin for that. But if it's if there's any issues with that, we can look at that as well as part of the New St. Paul's Hospital work. But just try and keep us updated as you sort of get that information, and then we can incorporate that.
Okay.
Can I just ask a question about that? Calvin, would it be you that would keep Kirsty, like the New St. Paul's team, apprised of any changes that happen between now and, like, it's not the responsibility of Sharon to update the New St. Paul's informatics team, is it?
Yeah, it would be me. I would update Kirsty.
Okay, perfect. Thanks.
Okay, so I do apologize that we've run over time a little bit. Thank you for everyone for joining us today. I don't think we will need to meet again for another session specific to this, but I can send the information out via email so you have the slides as well to refer to. And if there's any questions that do come up in the meantime, you can get back to me on that. Is there anything that anybody has to add or any questions for the end?
Just in
Okay.
terms of the second label printer, Kirsty, will
Yes.
you talk
Oh,
to
yeah.
Jason, or do you want me to talk to Jason about that?
If you can let us know after how it goes tomorrow with your decision on where the laser printer will be, the first label printer will be, and then we can take that away as well and find out
Okay.
about that second one.
Okay, I will update you tomorrow after the visit or Friday morning.
Perfect. Sounds good. Thank you. Okay. Thank you very much, everybody. I hope you have a nice evening.
Okay, thank you so much. Sorry
Thanks,
to keep
everyone.